In April 2013, the NHS underwent one of the biggest changes since its inception. This affected who makes the strategic decisions, how the money is spent, and who commissions services. In the 7 decades that the NHS has been in existence, there have been huge advances in medicine and substantial innovation in health technology. But the NHS is still struggling to understand how best to use this knowledge and make use of these opportunities, a task made all the more difficult by the shifting sands of its organisational structures.
A lot of the presentations have been around what's actually happened on the ground, so what's worked well, what hasn't worked so well, and people being honest about that, but also it not being a specific sales pitch of different technologies, actually around what is worked in practice from people who are really delivering it on the ground.
It's really interesting seeing the learning really sort of coming into the NHS now and how we can sort of practically apply that to ourselves going forward.
The benefits we see coming here is being able to get a quality audience across a very short period of time. What helps and assists is the organisation from AHA Media.
I've done really well from these events of meeting providers of various guises with various products. My organisation saved in excess of £1 million from meeting people here.
The speed networking was a very interesting innovation. I found it very useful. There was one particular company that I'd never considered talking to, but I will be following up with them.
I've got a number of contacts with people who I want to go and speak to at some point, either later on today or tomorrow morning, people that I wouldn't necessarily speak with.
But I found, everybody I spoke to very receptive, and the opportunity to arrange a more meaningful follow-up meeting. So good, very good.
We've had some very good one-to-one conversations, and the specific benefit from that is we've now got follow-up meetings that we'll arrange and go and see trusts and actually understand their strategy in more detail and actually get to work with them on certain pieces of work and help them actually shape things the way they need it to be shaped.
I've made some really good contacts. I hope to be able to carry on with some of those contacts. Everybody brings something different to the party.
It's a relatively modest investment for what looks like a fairly decent return.
To have that amount of senior executives within the health sector ready to meet with me, that's return and more on my investment, so delighted.